Joining us now is Dr. John-Zerwas, who advises Governor Greg Abbott and the Supply Chain Strike Force on hospital capacity and preparedness. He is Executive Vice Chancellor for Health Affairs at the University of Texas System. Dr. Zerwas, thank you for being with us. We thank you for your time. We know you're very busy, so let's get right to the questions. And here's the first one. With over 10,000 COVID-19 patients being in Texas hospitals, how strained are hospitals in this state due to the pandemic?
Well, they certainly are very busy at this time. So what we're seeing, though, is a flattening of the number of patients in the hospital. Now, this is a very encouraging sign, but this many patients in the hospital with COVID-19 is certainly a strain on the system, but the system is standing up incredibly well. We're looking forward to seeing those numbers obviously decrease, but in the meantime, to have had several days where, at least statewide, we did not see any increases or significant increases in hospitalizations is a very encouraging sign.
Doctor, how much more can the state do to help South Texas hospitals?
South Texas hospitals are probably strained more than any at this particular time. If you look at Corpus Christi, Victoria, on down into the valley, we're seeing, a very, very significant surge of patients down there. We're seeing the hospitals really filled to capacity. One of the biggest limiting factors for them, and it's true of all hospitals that get hit by the surge of patients, is the manpower. So through our private resources as well as through the Department of Defense and certain public resources, we've been able to flood well over 2,000 people down into the region in order to provide manpower for opening up additional beds and additional ICU capacity, but also to provide some very welcome relief to those people that have been on the front lines for so many days, hour after hour, shift after shift, taking care of what typically are very sick patients.
Doctor, how much has it helped to have 5 U.S. Navy teams working with hospitals in the Rio Grande Valley this week?
That has been, again, a very welcome relief, along with all the many other personnel that have come in. The Department of Defense, the Army has been down in there. We have had people from HHS come down, serve the area. DMAT teams have been there. They've come and gone. But clearly the largest contingency of the manpower has been the private resources that we've been able to garner by working with certain agencies that we have a relationship with and pulling people from out of the state into the region, and again providing this very, very needed manpower.
Dr. Zerwas, how much has Governor Abbott's suspension of elective surgeries in hospitals helped with hospital room for COVID-19 patients?
Well, I think the governor has taken a very proactive look at this, and it definitely has been something that has helped. He's looked at where, elective surgeries might take up a hospital bed or an ICU bed and says, hey, let's cut back on those things, and hospitals have done that. It's still allowed for the elective procedures to be done that don't require a hospital bed, such as ambulatory surgery or endoscopy suites, if you will. Those things have been able to go on as usual because they don't affect the capacity within the hospitals themselves. But it was a very proactive move by the governor, and just like his very strong, urgent, proactive masking directive early part of July, I think that's very contributory to the fact that we're seeing some flattening of the curves at this point, and we're seeing the ability to accommodate the patients in our hospital systems.
Finally, Dr. Zerwas, you have said that Texas has a shortage of supplies for testing. How key is it to get those supplies and to increase COVID-19 testing in the state?
Yes, testing is obviously still a very, very important part of the whole management of the pandemic. We have a lot of what I would call platforms to run tests. We have a lot of ability to acquire the specimens and the samples to run for COVID-19. But what we're really realizing now is the shortage is something called reagents. And these are chemicals that are needed in order to effectively run the tests on the various platforms out there. They're obviously in demand statewide, but they're in demand nationwide and to some extent even across the entire world. So We are working hard with the manufacturers of these reagents that are very typically, for the specific platform that you're running the test on. And so we're continuing to work. I know that the governor has had lots of conversations directly with manufacturers as well as the vice president, expressing the need to have these reagents on board.
Dr. Zerwas, thank you so much, and best of health to you and our fellow Texans.
Thank you very much.